Good morning. Thank you for joining us. Today's health briefing is the second in a series of bi-weekly briefings focused on presenting real-time COVID-19 healthcare data specific to vulnerable and at-risk populations in South Central Pennsylvania communities, inclusive of York, Lebanon, Lancaster, Hanover, and Gettysburg. This briefing is presented by Family First Health, a leading regional healthcare organization serving at-risk populations for the past 50 years. Family First Health is a federally qualified healthcare center serving more than 20,000 patients annually. We invite the media and the public to submit questions in the comments section of this video post or in advance of our briefings by emailing healthbriefings@familyfirsthealth.org. Copies of the video briefing will be made available online at familyfirsthealth.org shortly after each briefing. We will begin momentarily.
Good morning. Thank you for joining us today. As a community health care provider, Family First Health is dedicated to providing accessible health care that includes medical, dental, and behavioral health services to vulnerable and at-risk populations across South Central Pennsylvania. Today in this health briefing, we'll be discussing the reopening of dental care and talking about the continued realities of delivering care to a vulnerable population during this pandemic. We serve the South Central Pennsylvania region, but we are challenged like many communities across the country, faced with a virus that's disproportionately impacting certain members of our community, particularly vulnerable and at-risk community members. Our goal is to inform you of those realities with real-time data and that we compile regularly that reflects the care of our patients in our local community so that we can work collaboratively to achieve improved wellness and for our patients and improvements in the overall delivery system. By elevating understanding and giving a voice to those most affected by COVID-19, we hope to create an opportunity to bring necessary attention to the challenges that we have long known, how social determinants of health are weighing heavily on our patients' abilities to maintain their health. Add to that the challenges that a vulnerable population faces, being more likely to be essential workers, often in high contact industries. These individuals are at higher levels of exposure and potentially lost income due to the COVID-19 pandemic. Today, after reviewing our most recent data in relation to our patients' experience, we'll take a deep dive into the subject of reopening of dental services, what to expect, and how Family First Health is managing our reopening so that we can continue to provide high quality oral health care to our patients and the communities that we serve. So specifically today, our agenda will cover that updated data and reopening dental services and a bit of our providers' experience in that reopening of dental services and throughout the pandemic. As a reminder, please submit your questions and comments in the comments section to our producer, and we'll answer those in the live Q&A following the presentation. If we could start with the first screen of data. Just a reminder of the baseline state of Family First Health patients. A majority of our patients type of insurance coverage is public, Medicaid or Medicare, and about 20% of our patients have commercial insurance as their form of coverage. You can see the race ethnicity breakdown of our patient population, and then also income status. So an important factor to keep in mind is that a majority of our patients live at or below 200% of the federal poverty level, which also impacts access and their experience during this pandemic. If we can go to the next slide, we'll look at an update over the past 2 weeks in our patients' specific experience with COVID-19. So just as a reminder and framing that one of the indicators that we're looking at across Pennsylvania as far as thinking about reopening communities is the positivity rate experienced by each county. Fortunately, a majority of the counties that we serve have moved into the green or more open stage for the communities and economy. And one of those indicators is that those communities who have moved into the green stage have experienced a less than 10% positivity rate for the 2 weeks prior to moving into the green phase at least. Many of our counties have extended that less than 10% positivity rate well beyond that 2-week required period. Unfortunately, our specific patient population continues to trend at almost double that rate, or more than double the rate experienced in many of the counties that we serve. So York County is listed on our slide as an example. We're experiencing across the York County community about a 6.43% positivity rate. Our Family First Health patient population is experiencing an almost 19% positivity rate. You'll see a slight uptick both for the community rate and for our Family First Health rate in the past 2 weeks. We somewhat expect a slight increase as communities reopen and members resume some of our routine activities. But we would like this data trend to serve as a reminder that even in this green phase, continuing to exercise caution, practicing hand hygiene, wearing of facial coverings, and practicing social distancing are still things that we need to remember so that these slight increases don't increase and have a more negative effect on our overall population. And then, as you can see, a more disparate effect on Family First Health patients. We talked about in our last health briefing the disproportionate impact on our Latino or Hispanic population. And we'd like to say, as we're looking at that data over the last 2 weeks, if we can go to that third slide, we'll look specifically at that in a little greater detail. We've seen a slight improvement in the impact in our Hispanic population, but as you can see, we still have incredible disproportionate impact for the Hispanic or Latino population. So still running nearly 5 times more likely that if someone speaks Spanish or indicates their ethnicity is Hispanic, they're running an almost 5 times greater risk of testing positive for COVID-19 than their counterparts. So this is a disparity that we're keeping a particularly close eye on and will continue to share information about through these community health briefings. All right. We're now going to move specifically to a conversation about dental reopening. Many of you have understood or experienced yourself that dental services across the Commonwealth have been limited to emergency care until very recently. And so now we'll be able to take a deep dive into what that looks like, that reopening looks like for Family First Health. I do want to remind all of our viewers that we have been managing disparities in oral health and trying to address those for a number of years. And our dental services are specifically designed with health disparities in oral health in mind. And so I'm going to start by introducing our 2 dental leaders, Dr. LaJuan Mountain and Dr. Joe Mountain, who have been with Family First Health for 15 years. I've had the pleasure of working with during that time and have greatly enjoyed working with them to build a world-class dental service here in our South Central Pennsylvania region. I'm going to ask Dr. LaJuan Mountain to start off by first kind of sharing with us, as we've understood those disparities pre-COVID that have existed around oral health, how have our dental services historically been designed to help address those disparities, and what has been our scope of service and our approach to care pre-COVID-19?
Good morning, everyone, and welcome. When we discuss disparities of care or healthcare for patients, that definitely includes their oral health. When we, as Jenny stated earlier, we talk about our patient population, the majority of our patient population with a smaller percentage. The majority is that they have a state-funded insurance. They're on Medicaid or they have Medicare. Then we also have a population, as she stated, that have private insurance or that are considered self-paid, which you could imagine would be difficult for someone to receive care if they're having to pay for dental care out of their pocket. So what we've done as an organization is we have made sure that we're located in areas that patients that are having difficulty to receive care can access our care easily. We have enrollment specialists that allow our patients to come and sit with someone to see if they actually are eligible for insurance, so that they can move forward with progression of care. Then we also have a sliding fee scale, which allows those patients that have no insurance at all to set up essentially a means of determining how they can pay for care and get care with our organization. So when I say that we meet patients where they are, as Jenny stated, we're in Gettysburg, Hanover, our dental office are in Gettysburg, Hanover, York, and soon to be in Columbia. What we have done in meeting them where they are is, again, making sure that our doors are open, we're accessible, having a very dynamic, highly educated and committed dental staff. Our offices across the 2 regions are, they're manned by 12 providers that, as I stated before, are very involved and very caring for their patients. All of our treatment plans are dictated to what the patients need, what they present to us, so that we can make sure that we're helping and working and walking them along, improving their oral health. Oftentimes that means that we're convincing them to engage into their oral health, because most people don't engage the dentist until they're actually having a problem. So creating a comprehensive program that focuses on prevention, that we're trying to get patients to come in, again, not when the tooth hurts or the tooth is loose, but that they come in, they understand how to maintain their oral health with proper brushing, flossing, and using fluoride mouthwashes, coming in on a regular basis. That could be 6 months for some patients, 3 months for others. One of our bigger programs that we've instituted, where we're meeting our patients where they are, is our Kids Against Cavities program. This program focuses on our pediatric population. And with that program, we actually provide preventative care for those kids in their educational settings. So that's preschool kids through Head Start and Pre-K County, and then that's school-age kids in our York City School District, our Southeastern School District, and some other relationships that we have, such as York Learning Center. So in that program, we focus on preventative care. So we're doing exam, x-rays, cleaning, hands-on oral hygiene instruction that's done in front of a mirror to give patients feedback, fluoride varnish, and then sealants as well. So what that program does is it removes the barriers to care that many parents may find themselves experiencing, where they can't take off or they don't want to take the kid out of school. So kid remains in school, mom or dad does not take any time off, and those kids are actually able to receive those every 6-month visits that we would like to have those kids come into the office and see. That's actually done in their educational setting. That works for us twofold, because no barrier to getting into the office, but we also have a little bit of peer engagement, where everyone wants to do a good job in front of their friends. So we get more buy-in, we get more feedback, we get more encouragement, and those kids are actually able to have a very successful visit. It's also a more comfortable environment for them than actually walking into the dental office and having to get into our large moving chair. So that would be our biggest program that we've implemented, and I would say it's our best program because we're starting younger versus waiting until those individuals are older and may actually already be experiencing some type of dental problem.
That was a great description, and it causes me to reminds me even more the extreme pivot that our dental team has had to undertake in relation to COVID-19 and creating in many ways, building on what we've done in the past, but creating some new ways in which we're ensuring the safety of our staff and our patients, and our ability to continue to offer comprehensive care. So Dr. Joe, could you walk us through some of those pivots and what the dental team has had to undertake over the past few months in order to position us to continue to provide access to care to our patients?
I sure can. Good morning, Jenny. As Alon laid out, pre-COVID, we were a very busy practice. Middle of March, dental experienced a shutdown. We were mandated by the government to only provide a very limited scope of emergency care. We had to cancel all elective care for our patients. That was a very confusing time for patients. We did have to pivot. We had patients that were mid-treatment. We had patients that were new to our practice. One of the things historically we had always been proud of is that when we welcomed the patient into our practice, we really understand what were some of the things that affected their oral health. For some people, it was financial. For others, it was an access to care issue. Some people just didn't have the time, or maybe they didn't understand what they needed to do to become healthy. So we always tried to address their chief complaint first and really lay out an agreed to plan to get them healthy. Kind of COVID interrupted all of that. We had to pivot. We had to inform our patients that we would not be available to them to provide care. We had to do teledentistry where it fits. Dentistry is a very surgical profession, is very hands-on. I love interacting with technology. It was better than nothing, but it had its limitations in trying to improve a patient's oral health. Really, we relied on communication. As Alon said, we have a very talented team of dentists. They were very creative, but the parameters were very strict. It was really trying to help patients be in a situation that was safe, make sure no one had unmanageable pain, make sure there was no infection that was going on unnoticed and not being responded to, really keeping patients out of the emergency room so our medical professionals in the hospital could utilize and redirect that space for COVID patients. That was probably the biggest pivot, kind of the shutdown and making sure we were still there for our patients, communicating, having people understand what was happening, and also managing our staff during that time, making sure that everyone was healthy, everyone was safe, so we could be here for our patients.
So now we've started to reopen the doors. We've received guidance about how to structure our services in our office to enable us to offer a broader range of services. So moving from emergency services back to comprehensive care, and that's a question to you. What types of care could people expect to be scheduled for? And how are we kind of managing re-engaging folks at this point in time?
Well, some of the things what patients can expect to be scheduled for in our practice. We are able to resume their treatment plans. Just like the rest of the world, we are navigating the capacity issues, making sure we have the appropriate social distancing in our practice. We were a very busy practice, but we are here for our patients. We've been open maybe 2 to 2.5 weeks. Kind of in that time, we've really been spending the majority of our day re-engaging patients in those treatment plans that have been interrupted. That's all the dentures, all the scheduled treatment. We had to go back through our schedules and all the patients that we triaged during the time where our scope was limited to make sure that they are safe, that they're healthy, and kind of have an ability to re-engage them with care. I think the statement that I always go to is that each patient should connect with their dentist, establish that communication. Their dentist is the best person to guide them through their treatment plan. The dentist is going to understand the nuances that that patient presents with their health. They're going to understand the options that are available to them and be able to coordinate everything so that they get care that's effective and kind of personalized to them.
If I could jump in, so we're back to scheduling restorations. We're back to engaging our patients and completing their denture series so that they can get those teeth that they've been waiting for. We're doing root canals. We're finishing up crowns that patients had started, but they may have been temporaries. So we're back to providing that care that we always did. The area that we're working through is what we consider the foundation of our practice, which is our ReCare system, where we were engaging people readily to say, hey, you need to come and see us every 6 months, but capacity limitations provide an issue with that. So it's just stated to make sure that you're talking with your doctor, your dentist, to understand your next steps, because if you had a treatment plan, you don't want to forget about the treatment plan, because if left unaddressed, that condition just basically worsens. So we are back to providing all of those services that we were offering for our patients previously.
We are seeing less patients flow through our practice just in order to maintain safe social distancing and address all of those issues we need to take into account. We've also looked at things like airflow in our office. We've got some equipment on order, on back order, that will help us better manage the aerosol that is created during dental procedures. So we're looking at many kind of facilities issues. But one of the things that people have always known about our practice is that we've paid a lot of attention to personal protective equipment. I think most all of us now know what PPE is. Some of us may not have before, but that's always been an important part of our practice. And we've needed to make updates in relation to the increased risk around COVID-19. So I know the two of you are going to kind of walk us through what some of that looks like and the reasons why that PPE is offering better protection to our providers and most importantly to our patients.
I think, Luan, are you going to provide a bit of a demo for us this morning?
So yeah, so previously always wore a head bonnet. Always worn a gown. I would have normally worn a mask, a surgical mask, but now that's turned into an N95 mask. I would have worn my magnifying glasses to make sure that I don't miss anything in my patient's mouth. Now I'm wearing my magnifying glasses in addition to a full coverage face shield. And that full coverage face shield is modified with some upholstery foam so that it sits further enough from my face that I can wear both of these at the same time, where previously I would have only been wearing one to provide care for my patient. The face shield obviously is to prevent the aerosols from coming in contact with my face, but we've always kind of been in the range of being exposed to aerosols. That's been the nature of our business, which is why we've always worn PPE. So again, head coverage, now I'm wearing an N95. I'm still wearing my surgical glasses. I'm wearing a modified spiffied up full face coverage shield, and I'm also wearing a surgical gown.
So for either one of you, how does it feel to practice with this additional PPE? And has it modified your practice at all? Should patients kind of expect the same level of care? And how are you both adapting, and the rest of our provider team adapting to delivering care with this additional PPE that's required at this time?
We do have some additional PPE that we are utilizing. Our practice was well positioned to kind of make that adjustment. Pre-COVID, we were very well versed in following CDC guidelines, understanding the role of the FDA, understanding when the EPA comes into play. So we had some very strict and strong infection control policies in our practice. So we understood surface decontamination, hand washing was always prevalent, glove hygiene, and just really how not to cross-contaminate surfaces. So we were very comfortable with the language. We understood kind of what was being introduced, so we were able to adjust. I think patients will notice some similarities. I think they will experience things maybe going a little bit slower. I think that's probably due to some of the capacity issues. But our patients are great. They're going to make the adjustments right along with us. It was so fantastic to welcome them back into practice. I think everyone will be committed as a team to kind of move forward in a coordinated way.
I think the other thing that patients will see is also that it's very easy to pop a surgical mask on your ears and keep it moving and start patient care. It's a little bit more difficult to get the straps over your neck and over your head. I'm sure that we look a bit comical to them. And then also because our PPE has to be stored in a particular way to make sure, again, we're preventing cross-contamination. So there have been questions from patients, which is amazing because we've been able to educate them on why things have changed and the importance of this change. At the same time, they're just educated. So that affects the way that they actually engage their environment after leaving our office or just going through their day-to-day actions. So it's been really awesome to educate our patients, which is something that we've always done as a practice. We spent more time understanding what our patients are coming to us with, what they need, and how we can best support them so that they can be as healthy as they possibly can be.
So we'll start some questions. And one of those is what patients need to wear as far as face covering when they come into our offices and kind of what they should expect in the process. And after what you've just described, I think wearing a face mask like this probably shouldn't seem like that big of a deal after going through all the PPE that our dental team wears every day. But could you walk us through when a patient enters our facilities, what they should expect?
So what they would expect is actually dependent on the site that they come into, because all of our physical locations are different. But if I use George Street as an example, and then I'll compare it to Gettysburg, one of our smaller sites, there's a main lobby here at George Street. So there's a greeter at the main lobby that will ask them screening questions, and then we'll direct them to whichever service that they're here for, if that's medical or if that's dental. Once they come to the dental waiting area door, they will see markers on the floor, and they will be directed to our registration. What there is there are no longer the multitude of chairs in the waiting area. I think there's only like 4 now. And that's to make sure that there's social distancing. And with social distancing, we can only get 4 chairs in the waiting area. So they literally go from that registration checkpoint to standing at the door that would lead them to the clinical floor. There's no more sitting down after you would be registered. There's also a heavier lift that's done, meaning that our front desk staff is spending more time talking to the patients on the phone to pre-register them so that they don't have to spend a ton of time in the waiting area. So once they're standing on the floor marker that they would stand on when they are waiting to go onto the clinical floor, a clinical staff comes out, an assistant comes out, and the patient's temperature is being taken in the back. And again, they're having more conversations with their provider to make sure that they're healthy and that nothing's changed, not just with their overall dental health, but as well as with their overall physical health. So that would be the difference that they would see. It seems a little bit more structured and stand here, wait, don't move, we'll come and get you, we'll be right there. And if there's not a face covering that's offered, not a face covering that they have, we will give them one. But then when they come back to the dental area, they have to take that off anyway for us to evaluate them. So that would be the bigger difference, where I'm sure they feel like they're in a queue and they're being shuttled along, but that's the world that we now live in for social distancing.
Right. And offering protections to all staff and patients through this whole process, right? So there are health screenings, temperature checks, and an expectation that people are wearing a face covering outside of receiving their dental care, obviously. And if people arrive without one, then we'll provide one for them.
Yes.
We are also asking that a minimal number of people enter the office. So certainly if someone's bringing a young child, one adult may come with them. But unfortunately, and we miss seeing all of our families together, but we really need to limit the number of people in the office. So if it's an adult patient, we're asking that you come enter the office alone. And if it's a child, then one adult should come with them for care.
Yes, so that information's been discussed at that pre-registration over the phone. So those scenarios are the pediatric patient with adult patient, or the adult patient that requires a caregiver.
Yes.
So we are having those conversations so we can expect who it is that's actually going to come into the office with either of those two populations. The other thing that I would say is really different when the patients come into the office is that there's a patient in the chair and the chair next to that patient is empty. And that's never the way that our practices function. We normally have patients in all of the chairs. And that is, again, because we had restrictions around room turnover, where the room needed to sit a certain amount of time before we brought in another patient. That restriction has just been recently lifted. We've not changed our process as of yet, but that would be something different, that the patients would come into the office and would say, hey, it's pretty quiet in here. You know, it's not as filled as the office normally is.
Right. There's a little less bustle around the dental office, but that doesn't in any way reflect people's commitment or the need that we know exists in our patient population in the community. We got a question from the community about the difference between the positivity rates and positive number of tests. So this is an area that we've been watching from very early on in the pandemic. We can look at a raw number of tests, so how many people are being tested. And when we look at a graph that depicts that for our practice and for the community at large, we went from 0 March 13th, because we were not testing for this, to many more tests being done every single day. So we would expect that the overall number of tests increases. What we'd like to see is we see mitigation and better control based on our stay-at-home orders and other modifications that we're making in the community, is that positivity rate. So the percentage of those overall tests that are positive, we want to see that decreasing. And like I said, one of the factors that we look at here in Pennsylvania is that counties are running a less than 10% positivity rate for their overall county population in order to indicate a level of control of the virus. So the difference is between the raw number and the percentage of positive tests. And like I said, something we've been watching from the beginning is that in our patient population, folks who are more likely to be essential workers, maybe living in denser housing, and may be predisposed because of pre-existing conditions, have a higher positivity rate than the overall community rate. So again, our patients are running about a 20% positivity rate. That was down from a high of 24%. And our overall community is running about a 6% positivity rate. So again, these are the disparities that we have. This is one of the ways disparities manifest, and we have seen this historically in health outcomes, and we certainly are seeing COVID impacted in the same way. And we'll continue to talk about the disparate impact of COVID as we move through these health briefings over the coming weeks. I don't see any more questions at this point, so we're going to move to wrap up, and I'd like to actually turn it back to Dr. LaJuan Mountain to just share a little bit of her personal perspective on what it's been like as a dentist and a leader within the Family First Health structure to navigate through the last 3-4 months and the impact that that's had on her and her practice and her perspective as a dentist. So I'll turn it back to you, Dr. LaJuan.
So I would describe it as living in the twilight zone and wanting the episode to end. but it's not ended. And to have to pivot and make changes based upon the guidance that has been given to us by the Department of Health, which has been based upon their guidance from the CDC. So I would say, to understand the severity of this virus and what it's doing to the communities across the country, it's something that we acknowledge, we recognize, and we completely respect. What we've experienced is that we were left at a spot that we could not support our patients, where for years we fought the battle of educating our patients about the importance of their oral health, that it is the gateway to the rest of their body, that they have to engage, they have to value it, they have to find it to be extremely important. But then have to make those phone calls to share with our patients that we had to stop care, that we wouldn't be able to clean their teeth, that they wouldn't be able to get their dentures despite the fact that maybe they didn't have any teeth, that they wouldn't be able to get that crown. We answered a lot of questions then about how important our message was. So is it really, really that important to have dental care if we were able to stop it and they were just to wait until we were actually able to re-engage them? That's a very helpless place to be, in a sense that we are the experts that are supposed to support them in regards to their oral health. And once you have someone committed to have that care just stop, it be a standstill, it brings questions from the patients. So we're also at the spot now where we're making tons of phone calls and we're spending lots of appointment times re-educating, getting our patients recommitted and getting them back on board with their care because they've gone with it for a while now. That's something that we have to get them to buy back in. As a healthcare provider, to feel helpless, that's just not a fulfilling place to be. And I'm saying that not just as a person that's responsible for the department, but this is the feedback from the providers that are within our department that are committed to taking care of the patients in the community. So we're back. My take-home message would be to make sure that you're taking care of your teeth, that you're still brushing, that you're still flossing, that you're still using some form of mouthwash, despite the fact that you may not be leaving your home every day. It's still important to take care of your teeth every day. And that you would contact your dentist to find out how you re-engage in care, what next steps for you for care are, because things may have changed during this period of time for a patient. So it's awesome to be back in the saddle, to be able to support our patients, to be able to give them guidance, and to actually be able to walk them closer to that end journey or end spot of actually having oral health where they're stable and they're able to sustain that care, because not having good oral health is just an increased risk factor. It's one more risk factor that a lot of our patients have to deal with, just makes them more susceptible to things such as this COVID virus, because there are many things that are competing for their attention. So prevention is the main message. We're back at our offices. Contact us so that we can help you become as healthy as possible. Thank you.
Thanks, Dr. Mountain. I think you've reminded us, your reminders prompted me to add something to our list of hand washing, social distancing, and wearing a face covering is also remembering your oral hygiene and not leaving any piece of that home care or self-care out during this time. So thank you for both for participating today, and a huge shout out to the entire dental team. Every member of the healthcare team has experienced, at Family First Health has experienced challenges, but I think our dental team really carried a heavy load over the past few months, and we're excited to have everyone back in the office and to welcome our patients back as well, as you reminded us, Dr. Joe. I want to thank everyone who joined us today for this health briefing. Copies of the data will be provided on our website at familyfirsthealth.org immediately following the briefing. We'll have our next briefing on Thursday, July 9th at 9 a.m., and we hope that you join us then. Please follow our social media channels for all the latest updates on all the activities at Family First Health, including our continued efforts to respond to COVID-19. Thank you all and have a good day.
Thanks.
Thanks.